A man does not lose the ability to enjoy sexual interactions as he ages. As people age, bladder cancer also becomes more prevalent. Although they do happen, testicular malignancies tend to affect younger men more frequently. In this video, we are going to discuss the male reproductive system's aging changes, fertility, urinary function, impact of changes, erectile dysfunction, prevention, prostate, and sexual hormones in aging. The male reproductive system's aging changes. Testicular tissue, sperm production, and erectile function are among the male reproductive system's aging changes. Usually, these modifications take place gradually. Men do not, like women, go through a significant, quick shift in fertility as they age. Rather, changes happen gradually during the course of what some refer to as andropause. The testes are where aging changes in the male reproductive system mostly manifest. Mass of testicular tissue declines. The male sex hormone testosterone steadily drops in concentration. It could be difficult to achieve an erection. Rather than a total collapse, this is a general slowdown. Fertility. Sperm-carrying tubes may lose some of their elasticity due to a condition known as sclerosis. Although the pace of sperm cell creation slows, the testis still generate sperm. Some of the surface cells in the prostate gland, seminal vesicles, and epididymis are lost. However, they still generate the liquid that aids in the movement of sperm. Urinary function. With aging, some of the prostate tissue is replaced with tissue that resembles scars, which causes the prostate gland to grow. About 50% of men have this illness, known as benign prostatic hyperplasia (BPH). Delays in ejaculation and urination may be related to BPH. Changes in the urinary system are strongly linked to changes in the reproductive system in both men and women. Impact of changes. Every man is not born equal. Male fertility is not predicted by age. Fertility is not impacted by prostate function. Even after having this prostate gland removed, a man is still able to reproduce. It is possible for some fairly old men to have children. Typically, the amount of fluid ejaculated stays the same, but the fluid contains less viable sperm. There are males who may have less libido or sex drive. It is possible for sexual reactions to become softer and delayed. This could be connected to a drop in testosterone. It may also be brought on by illness, long-term chronic disorders, medications, or psychological or social changes brought on by age, such as the loss of a willing spouse. A man does not lose the ability to enjoy sexual interactions as he ages. Erectile dysfunction. For older men, erectile dysfunction may be a concern. Erections typically happen less frequently now than they did when a man was younger. Men who are becoming older typically have trouble ejaculating repeatedly. Rather than being the product of aging alone, ED is typically the result of a medical issue. Instead of being psychological in nature, 90% of ED erectile dysfunction cases are thought to have a medical explanation. Certain medications, like those used to treat hypertension and other diseases, can make it difficult for a man to achieve or maintain an erection strong enough for sexual activity. Diabetes and other conditions can potentially lead to ED. Treatment for ED brought on by disease or medication is frequently successful. If you have any concerns about this disease, consult a urologist or your primary care physician. Urination may eventually become difficult due to benign prostatic hyperplasia. The urethra, the tube that drains the bladder, is partially blocked by the enlarged prostate. Urinary tract infections are more common in older men due to changes in the prostate gland. If the bladder is not completely emptied, urine may reflux into the kidneys. Vesicular urethral reflux. Kidney failure may eventually result from this if it is left untreated. Prostatitis or inflammation of the prostate gland can also happen. Men who are older have a higher risk of prostate cancer. It is among the leading cause of cancer-related mortality among males. As people age, bladder cancer also becomes more prevalent. Although they do happen, testicular malignancies tend to affect younger men more frequently. Prevention. Many of the physical changes associated with aging, like testicular atrophy and prostate enlargement, are unavoidable. Treating medical conditions like diabetes and high blood pressure can help avoid issues with sexual and urination. The most common causes of changes in sexual response are not just age. If they maintain their sexual activity throughout middle life, older men are likely to have satisfying relationships. Aging-related hormonal alterations may contribute to the etiology of prostate disorders. Those include variations in cortisol, insulin, thyroid hormones, insulin-like growth factor 1, and sexual hormones. Significantly, hyperinsulinemia is linked to hyperplasia and inflammation of the prostate, as well as effect on prostate tissue. The processes underlying this relationship are still poorly understood. Prostate and sexual hormones in aging. Among the most prevalent disorders affecting older men are prostate diseases and androgen deficiency. Numerous extensive cross-sectional investigations have demonstrated that men's levels of testosterone decrease yearly by about 1% to 2% as they age. The prostate gland often grows larger as one ages. When a person is between the ages of 50 and 55, their prostate measures 24 to 25 ml, which is about the same size as a golf ball or walnut. When they are older than 75, their prostate gland measures approximately 38 ml. In other words, if the prostate gland weighs 80 grams, we can consider it enlarged and suspect benign hyperplasia. Unless the PSA free percentage is less than 25%, in which case a tissue sample from the prostate itself must be taken and examined to ensure there is no cancer. If the prostate volume was 24 to 38 ml at the age of 50 to 80 years old, it is normal and not caused by a disease. So, what should you do if your prostate becomes abnormally large? It will impede the flow of urine from the bladder and the urethra. Therefore, you need to have a proper diagnosis to make sure the prostate is not in a dangerous condition. That's it, folks, for today's video. Let me know